Hello, and welcome to the second Impact webinar this year. My name is Lauren Clack from the University of Zurich, and it is my great pleasure to welcome you to this webinar, and especially to welcome our guest and presenter of this webinar, Professor Byron Powell. We're really grateful to have you, Byron. Thanks for being with us. And I will begin with a brief introduction of Byron. So officially, Professor Powell, or Byron, is an associate professor at the Brown School at Washington University in St. Louis. And in his role there, he actually holds many hats as co-director of the school's Center for Mental Health Services Research, also co-director of the Institute for Public Health Center for Dissemination and Implementation, and also co-director of the Institute of Clinical and Translational Science Dissemination and Implementation Research Core. So he's not bored with all of his roles at the University of Washington in St. Louis, Missouri. And Byron is also very active in his national but also international collaborations. In 2022, he also received a Fulbright Specialist Award to spend time in Ireland at the University College Cork. And Byron is really someone who I've enjoyed having discussion with. I think he's really a great thinker. Many of you will know Byron either through collaborating with him directly or through the work that he has published. And in particular, Byron has made really important contributions to the field of implementation science with some of the work that he's done around implementation strategies. For example, the expert recommendations on implementing change, this famous taxonomy that all of us know and have worked with. So really, it's a pleasure to have you, Byron. Thank you for being with us. I will hand over the floor to you for about 45 minutes, and then we have plenty of time as well for some discussion at the end of the presentation. So thank you, Byron. The floor is yours.
Great. Thank you so much, Dr. Clack, and thank you for the opportunity. It's great to be with you all. I think I just need permission to share screen, if that's easy to do, and then I will kick off here. And thank you all for joining. Good to see some familiar names in the chat, and looking forward to connecting with you all.
While we're getting that set up for Byron, I also just want to mention, please feel free to, while Byron is speaking, to list your questions in the chat. And we'll be moderating the chat, and at the end, we'll also be going through all of the questions. So feel free to add your questions in there directly. Thanks.
Great. So I think we're in business, if that looks okay on your end.
For me, it's perfect. Thanks, Byron.
Excellent. All righty. Thank you again for the opportunity, and looking forward to our discussion today. Just to kick us off here, I'm going to hope to cover a few different topics here, starting with some work to think about how do we better identify and classify implementation strategies. Then I'm going to talk a bit about improving our efforts to design and tailor implementation strategies so that they're better suited for the types of interventions and contexts that we're working in. And then going to shift a bit to how we evaluate implementation strategies better. And in particular, can we get better about specifying and testing how and why implementation strategies work or their mechanisms of change? And can we better track and report implementation strategies so that we can improve the replicability of our work and really learn from both our successes and our failures in the field? So to start off with, and just to sort of level set here, we've defined implementation strategies as methods or techniques used to enhance the implementation, adoption, implementation, sustainment, and scale up of a program or practice. And a lot of times in our work, we refer to discrete and multifaceted strategies. So these are maybe sometimes a bit of a misnomer, but we talk about discrete implementation strategies as single actions or processes. So things like clinical reminders, audit and feedback, or clinical supervision might be examples of discrete or single component implementation strategies. I note the misnomer because these are actually quite complex implementation interventions or implementation strategies in their own right. More often than not in implementation science, we're dealing with multifaceted strategies that might even be multi-level. You'll sometimes see this termed in the literature as implementation interventions or the like that really combine multiple discrete implementation strategies, hopefully in ways that are sensible and well aligned with the types of determinants we're addressing. And when we first went to the literature, this was way back in 2010, 2011, we originally went to the literature to try to answer this question, what are the effective implementation strategies? And one of the things that we came across was this Tower of Babel problem where, people would use the same term to talk about very different implementation strategies, or they'd use different terms to talk about essentially the same thing, which really, leads to this issue of pseudo innovation in the field. And so we thought a useful first step is just simply naming and defining these implementation strategies. So in 2012, we published this compilation of implementation strategies that named and defined 68 discrete strategies and categorized them into 6 different categories. We thought that was a useful first step to hopefully improve reporting in the field and give people a bit of a menu by which they could consider different implementation strategies for their research and practice efforts. We had the opportunity, fortunately, we were approached by Joanne Kirchner, Tom Waltz, and others from the Department of Veterans Affairs in the US, who said, this is a sort of exactly what we were looking for, but we would like to take this work to the next level by really vetting these terms and definitions of implementation strategies with experts in implementation science and practice. So we conducted a modified Delphi process, a 3-round Delphi, to refine that compilation, and also conducted a concept mapping study, which is a structured sorting and rating process that yielded 9 discrete categories of implementation strategies that I'll show you on this next slide. And I won't belabor this. This is the ERIC compilation that Dr. Clack was referencing earlier. Sometimes point people to the additional file of that 2015 paper below. But again, 9 different categories and 73 discrete strategies here. I think I'll give examples of these throughout the presentation, but if you'd like to take a further look at that work, please do at the citations below. Again, the intent here was to really identify building blocks of multi-level, multifaceted strategies for research and practice, and hopefully, at least in some small way, address this Tower of Babel problem. But there's plenty of room for critique, dialogue, and ongoing refinement of this work. We've been pleased to see it picked up, at least in the U.S., by a number of funders and other important federal institutes as guidance for implementation. But there have also been a number of really insightful critiques. One of which is that it was really developed with a decidedly North American bent, and primarily the U.S. and just a smattering of folks from Canada. So there are questions about sort of how is this relevant internationally? There are questions about strategies that seem to overlap, and certainly room for expansion and refinement over time. And many folks have really taken that on. My colleague Sherry Rogal, who's a physician and researcher at the University of Pittsburgh and the Pittsburgh VA, has partnered with Vera Yakovchenko and others to really advance this work in a lot of ways. Sherry has turned this compilation of implementation strategies into a survey that can be used prospectively or retrospectively to examine the use of implementation strategies in large-scale implementation efforts. And the papers on the top show some evaluations from those efforts using that survey, which she's continued to refine over time. The red box around this article suggests shows a paper that uses cognitive interviews to refine the survey, and she's continuing to do that in funded work through the Department of Veterans Affairs. I also just wanted to quickly highlight a couple of papers in case any of you are interested in configurational comparative methods, which are methods that really get at this notion of equifinality, that there's more than one way to be successful in implementation. So these methods examine, what strategies are both necessary and sufficient to lead to our ultimate outcome of interest. And so those papers on the bottom right demonstrate the use of that method. I believe actually Dr. Clack and perhaps others in the audience have used this method and are probably more expert than I, but happy to talk about that more. We've also seen this compilation be extended for a number of different contexts. We intended this work to be, broad and sort of generic enough in a good way to be relevant to a lot of different clinical areas or areas within social service, mental health. But some people have actually extended it to specific areas. So Clay Cook and colleagues have adapted it for school mental health. Andrea Graham and colleagues have used it for digital mental health interventions in healthcare settings. And Alex Dopp has extended this based on a scoping review to actually examine 23 different financing strategies in behavioral health. So it's very nice to see these expansions and refinements of the compilation over time. There have also been a number of questions about how do these strategies, how do implementation strategies differ than like sustainment strategies or de-implementation strategies and interventions? And I think largely so far we've seen that there's a lot of overlap, and perhaps there are some unique sustainment or de-implementation strategies. But these papers on this slide have applied this compilation to de-implementation and sustainment respectively. I'll also point out that if you're interested in sort of broadly what phases do these ERIC-defined implementation strategies fit in, this paper by Nicole Nathan is a nice resource for that. I mentioned sort of the question about how do these strategies apply internationally, and particularly do they apply equally as well in low and middle income countries? That's to be fair, I think an ongoing question. My colleague Kate Lavero at Columbia here in the U.S. has recently conducted a systematic review of how this compilation and this taxonomy has been applied in low and middle income countries, and largely found that it's increasingly applied and relevant. But also, again, perhaps pointing to some strategies that are unique or at least more often emphasized in those settings. Similarly, Elvin Gang and colleagues have conducted a living meta-analysis of HIV implementation science. You can check out the sort of the dashboard for that at the link below. And they coded their implementation strategies using different approaches. So they use the ERIC compilation. They also use something called the Effective Practice and Organization of Care Group taxonomy, and then also inductively coded strategies that didn't quite fit in either of those taxonomies. And I don't have this on the slide here, but one of the things that they found is a lot of these strategies were sort of at the patient level. So there's, I think, increasing attention in the implementation science literature about how many of these strategies can be sort of patient-focused, patient-mediated implementation strategies, and has that been a neglected area of emphasis? You may have seen a paper by J.D. Smith that talks about adjunctive interventions in implementation science. That's probably an obvious omission from this slide that I should add here. We're also pleased to see this compilation translated into a number of different languages, including German. There's a Spanish translation under review and a Japanese translation that's underway. So hopefully that will increase its use and hopefully its utility over time. So again, just thinking about how we can better classify and discuss our implementation strategies and interventions in consistent ways, there are a number of other tools by which we can do that. Some of you may be familiar with intervention mapping or implementation mapping. This is a taxonomy of behavior change methods that has been published along that work. and is available through the link below, the full sort of taxonomy. And I think, these are just examples on the slide, but I think quite helpful as you're considering how your implementation strategies operate to change behavior. Similarly, many of you are likely familiar with the work by Susan Mickey and colleagues to develop the behavior change technique taxonomy. And as I'll show on subsequent slides, that's iteratively developed over time as well. My colleague Sheena McHugh at University College Cork has actually looked at the complementarity between the ERIC compilation and the behavior change techniques. The ERIC strategies are defined at a much broader level. And so our original thought was that the behavior change techniques can actually do a lot to demonstrate what are the sort of active ingredients of these implementation strategies and perhaps better define or even be used to tailor those implementation strategies in a helpful way. So would encourage you to take a look at that paper if you haven't seen it, to see sort of the synergy between these two taxonomies. I'm hoping during the discussion that maybe some of you have more experience with this than I have. But the Human Behavior Change Project has been a really ambitious project led by Susan Mickey and colleagues at University College London, where they've now developed the behavior change technique ontology, which contains 281 behavior change techniques in 20 groups and 5 levels. As well as an ontology of mechanisms of action in behavior change interventions. So I think I just wanted to point that out in case folks are not familiar with those developments. I think it's going to take me more time to sort of dive into that work and understand how it's used and how it can be helpful in implementation science. But I think potentially very useful, and hopefully again folks are aware of that. This is an outdated slide, but I just wanted to have it in here just to suggest that there's a growing body of evidence for different implementation strategies. If you're not familiar, the Cochrane Effective Practice and Organization of Care Group, amongst others, have done a lot of work to conduct systematic reviews or support systematic reviews and meta-analyses of these implementation strategies. There have been reviews of reviews, as I'm going to show on a subsequent slide. And so I think a growing body of evidence that can inform the selection of implementation strategies oftentimes is not perfect. And I think, as I'll show on the subsequent slide, I think the questions in the field are moving rapidly to thinking about shifting from, as Boaz and colleagues suggest, shifting from merely examining what works to really thinking about what works where and what works for whom. They also concluded that exploring the complex and situated nature of the evidence in the field is important, and that we really need to explore the complex processes involving a range of actors within different capacities, with different capacities working in diverse organizational cultures. So I think increasingly we're moving towards, again, how and why implementation strategies work, how we can optimize them over time, how we can make them better fit to purpose for different interventions, implementing partners and settings. And so if you haven't seen this paper by Annette and colleagues, do take a look at it. Ambitious, reviewing 86 systematic reviews of implementation strategies focusing on change in clinical practice. So an impressive body of work there. Speaking of sort of moving towards complexity, I'm going to say more about this later on in the presentation. But one of the things that the previous paper mentions is sort of a focus on realist evaluations, realist reviews, which many of you may be familiar with. This review in particular, I found really interesting. This might be overwhelming to look at this causal loop diagram on this page, but I think one of the things that this paper does really nicely is that the authors, had an initial program theory for how pay for performance in this case was supposed to work. And then they conducted a review and revised that program theory over time, and also depicted the complexity of this using these causal loop diagrams, a system science tool to really identify leverage points for change and show how these different determinants and strategies interact with each other, I think, in complex ways. And I think as we move forward in the field, increasingly, hopefully we'll have more nuance about how and why implementation strategies work and sort of how we need to optimize them over time. So I think this type of iterative theorizing and theory development is quite important for the field as we move forward. As many of you have probably heard, usually I have a slide that I probably stole many of the things from Jeremy Grimshaw and/or Justin Prousseau, but too often in the field we use sort of the train and pray or train and hope approach. We use sort of kitchen sink approaches where we might assume more is better. We have a lot of inertia, so sometimes we think of, we've always done it this way. And we use what Martin Eccles would say is sort of the Islagiad approach, or it seemed like a good idea at the time. But all this leads to this phenomenon that Michel Vensing and Richard Grohl suggested, that there's often little association between the type of problems that we are facing and the types of approaches taken to address them. So oftentimes this leads to, even when we identify organizational and system level factors, they tend to be ignored in favor of individual educational and psychological approaches. And so a lot of the work that we've been engaged in recently has been focused on how do we improve, enhance the impact of implementation strategies by more thoughtfully designing and tailoring them to various contexts. And so we've outlined some of these priorities in a book chapter and a paper that are several years old now. But I think these are still relevant in terms of efforts to enhance methods for designing and tailoring implementation strategies, specifying and testing mechanisms of change, or how and why they're supposed to work, and then improving the tracking and reporting of implementation strategies. And I'll just note that I'm not going to focus today on either economic evaluations or even much on implementation trials. We certainly need more effectiveness research on implementation strategies and more economic evaluations moving forward. So there are a lot of different systematic approaches to develop interventions, or in this case, implementation strategies. And I'm going to show some examples on subsequent slides. But this is an older paper by French and colleagues from 2012 that lays out an approach to developing theory-informed implementation strategies. And I think regardless of the type of approach you use, many of them have these sort of core steps underpinning their processes. And so just briefly, first, identifying who needs to be at the table based on who needs to do what differently in order for implementation, sustainment, scale up to be improved. And I note here, not as an afterthought, but that we really want to be considering equity at each of these steps. Again, who's at the table, who's influencing implementation, and more importantly, who's impacted by implementation efforts, and can we make sure that we're being inclusive and considering the needs of all partners in that sense. The second step is to really use informal or formal theory and frameworks to identify implementation determinants, or barriers and facilitators, barriers and enablers, whatever terms you use here, to really articulate a pathway of change for this targeted behavior change to occur. And we'll note here that a variety of methods have been used here. So thinking about, qualitative methods such as semi-structured interviews, focus groups, those are obviously common. It's great to see increasing use of ethnographic work to understand how implementation is actually working or failing in a given setting, and learning from positive deviance when possible. We also see quantitative surveys that are quite helpful in helping us to understand the context that we're working in. It can also be much more informal consultation, or I'd be remiss to not say, really we should be first going to the literature, as we have a growing body of literature that supports the presence of certain barriers and facilitators across different clinical areas and settings and contexts. So certainly that's a place to start. The third step is then, of course, to select implementation strategies that are likely to be effective, locally relevant, acceptable, and feasible in the setting. And this paper, led by Luke Wolfenden and colleagues, we specified that this includes implementation strategies, also include behavior change techniques. So that work that demonstrated the synergy between behavior change techniques or behavior change methods and the ERIC implementation strategies, I think, is important here. And then finally, I won't speak a lot about implementation outcomes in this talk, but we need to think about how we can robustly and feasibly measure our ultimate outcomes of interest, any intermediate implementation outcomes or more proximal outcomes of interest, and basically any factors along the hypothesized causal pathway as we consider this. I wanted to emphasize here also that participatory approaches to implementation science are critical. And I think this is a great paper by Shoba from Harvard, who suggests ways in which participatory implementation science can really be integrated at each of these phases. So as we're identifying implementation determinants, as we're considering the best implementation strategies to use, as we're considering how and why those strategies might work or examining mechanisms, and as we're considering outcomes that are important and really prioritized by our key partners, participatory approaches are critical. And so certainly I'm going to share some examples of specific approaches that participatory activities can be built into. But I think this is a great paper worth your time if you haven't seen it. So I include this just to provide an example. I've talked about discrete implementation strategies. I talked about multifaceted strategies, and hopefully the notion that we're putting these together in ways that are synergistic, such that 2 + 2 = 5. This is some work that was motivated by a great paper by Brian Weiner in 2012 in the Journal of the National Cancer Institute, where Brian outlines different approaches to thinking about multifaceted and multi-level implementation strategies. And this paper is led by Sam Schilling, who's a child abuse pediatrician at the University of North Carolina. And she had developed and had been testing a now evidence-based child maltreatment prevention intervention called PryCare. And one of the things that she found in North Carolina was that people weren't getting referred to this. So it was evidence-based. They were excited to roll it out, but oftentimes doctors were not referring to the practice, and obviously then patients were not benefiting. And so Sam designed this implementation strategy. What you see here in the rectangular boxes are implementation strategies. And she hopes that public recognition. So basically, it turns out doctors are competitive, and she had monitored their performance and basically turned this into a bit of a competition with a small, Starbucks gift certificate as a reward to provide some public recognition for physicians who are referring to PryCare. She also disseminated parent narratives to physicians to hopefully motivate them by allowing them to hear from patients who had benefited from the PryCare intervention. And she hoped that those two strategies would work in an accumulative fashion to address clinician motivation. She also employed an audit and feedback implementation strategy to hopefully amplify the effect of those two strategies on clinician motivation. So measured referral rates, fed that back to physicians in comparison to their peers. She prepared parents to be active participants by sending out a MyChart notification to parents that described the intervention and hopefully motivated them to engage with their physicians about the intervention, ask questions, and hopefully ultimately enroll in the intervention. And then finally, Sam used a clinical reminder, so an electronic medical record pop-up that would hopefully facilitate the effect of these implementation strategies on her ultimate outcome of interest. And so in this case, she was able to demonstrate an increase in referrals from 13% to 55%, this was not a randomized controlled trial. This was a more pragmatic, quality improvement driven approach. But I think this is a really nice paper, if you haven't seen it, in terms of demonstrating how one might justify and motivate the selection of implementation strategies based upon evidence, theory, and partner input. And so she does a really nice job of laying that out. And hopefully, I think a nice job of showing how these strategies fit together to achieve her ultimate outcomes of interest. So I mentioned that there are many different systematic approaches or methods for designing and tailoring implementation strategies. A number of years ago, we published a paper that outlined 4, including concept mapping, group model building, intervention mapping, and conjoint analysis. Heather Cahoon at the University of Toronto has conducted a systematic review where she identified 15 papers with replicable methods for engaging in this process. And as I mentioned when I gave the overview of the French paper, I think many of these steps are common across these approaches in terms of identifying barriers, linking barriers to intervention components, using theory and engaging users. So I think we can identify a lot of common elements across these approaches. And I think, in fact, a useful future endeavor might be to actually identify the common elements and specify the common elements of these approaches. So Thomas Engel, if you're in the audience, we might chat about that sometime. So just real quick, I wanted to give some exemplars of these systematic approaches that we can use to better design and tailor implementation strategies. Many of you may be familiar with intervention mapping. This is a systematic protocol for designing interventions that has existed for a long time and well used in public health in a variety of fields. It's always included a step that focuses on implementation and the development of implementation strategies. In recent years, Maria Fernandez and her colleagues have sort of specifically applied this within implementation science and increasingly tried to demonstrate how it can be used for a variety of different implementation challenges. And so it's been sort of recast in that light as implementation mapping. And I won't go over these steps in detail, as I think they're quite similar to the French et al. Slide that I shared. But essentially, you can use this in a lot of different ways. So you can use this to adapt interventions. You can use this to design an intervention for implementation and sustainability, so that it has, that it's feasible, well suited to the needs of implementers and the like. We've used it within the context of large implementation trials when we have some idea of what we think the implementation strategy might look like, but we want to refine that in the preliminary phases of a study. So for instance, the paper all the way on the right is a study in Vietnam where we've now concluded data collection and are analyzing results, where we used implementation mapping to design a standard and a tailored condition within that implementation trial. We've also used implementation mapping within the context of a pilot to basically co-create implementation strategies with community mental health agencies. So this was based on the notion that individual organizations have unique strengths and needs, and may actually require very different implementation support. So we used this implementation mapping process through this intervention called COAST-IS to essentially work with organizational clinicians and leaders to design implementation plans for their sites. Did want to point out this the link at the bottom of the page. If you're interested in other examples, we recently published a special collection in Frontiers in Public Health on implementation mapping for selecting and adapting implementation strategies. So just wanted to quickly share this paper, as I think it illustrates something important within these sort of structured or systematic approaches to developing implementation strategies. This is based on an approach called evidence-based quality improvement that Jeff Curran and colleagues at the University of Arkansas for Medical Sciences and elsewhere have used and refined over the years. And Taryn Swindle just led this review of the EBQI process. And one of the really helpful things from this paper is this table on your right. Hopefully you can see this okay. But what I like to point out is that, again, the steps on the left here, are kind of quite generic and I think cross-cutting across a lot of these different systematic approaches. But what is actually unique are the activities that are used to accomplish these steps. And so here I think you have plenty of reading to do if you're interested. But the point for me is that we have room for creativity. Some of these probably vary in their level of formality and rigor, but we have room for creativity, and we also have room to innovate over time about how we accomplish these steps. Hopefully, over time, we're accumulating some level of evidence about the types of methods that are more or less helpful, more or less appropriate to different groups and contexts. But I think there are a lot of potential options on the menu for this type of work. Just wanted to quickly mention, I mentioned, participatory approaches as well as system science approaches. This is an example from Giselle Corby-Smith and Gaurav Dave, who are using community-based participatory methods for identifying implementation determinants and developing implementation strategies through some of their NHLBI-funded work in North Carolina. And the first stage of that was really to conduct a concept mapping study to identify and prioritize barriers and facilitators. But they're also using systems thinking and group model building principles to think about how do these different determinants interact in complex ways, and how do we develop a nuanced understanding of that context to hopefully develop implementation strategies that are more effective. So I mentioned the ERIC compilation earlier. One of the things that we've done is to develop a tool to link the ERIC compilation to a well-used framework in the field. Many of you will be familiar with the Consolidated Framework for Implementation Research, or the CFIR. And the idea here was that if you identified a barrier according to CFIR, such as low reflecting and evaluating, which is a process level barrier in CFIR, you can actually enter this into the tool, and it would suggest some strategies that have been endorsed by experts as potentially appropriate or effective implementation strategies for addressing that barrier. So what you see below here, level 1 and level 2 recommendations, actually corresponds to how frequently they were endorsed by experts. So more than 50% of respondents endorsed these implementation strategies that are deemed level 1. So this is a tool that you might play with. The link is below, and the Waltz et al. Paper 2019 shares the methods and results of that study. So you might take a look at this and just play with it. I sometimes go back and forth between thinking whether that was a failed experiment. We had a wide range of strategies suggested, but we also I think see some face validity in the tool. And actually, Very Yakovchenko and Sherry Rogal and colleagues have recently published a study where they basically compared the strategies that would be suggested by this tool to quote unquote real world effectiveness data, and they showed that there actually is some potential promise and utility of this tool over time. We're also excited to advance this further. Sherry has some work funded by the Department of Veterans Affairs called the OASIS Project, where they're hopefully going to use machine learning to iteratively refine the strategy selection tool over time, and hopefully make that more useful and pragmatic for potential users. I won't dwell on this slide, but since I mentioned the behavior change technique taxonomy and that work by Susan Mickey and colleagues, I wanted to point out this as a very helpful companion to that if you're using those techniques. And again, perhaps some of you have much more experience using this than I do, and would gladly discuss that during our time today. We've also focused a lot on advancing work around tailoring implementation strategies, some of which I've already mentioned, but there's some evidence that this is an effective approach. This is a rather old review now by Baker and colleagues that suggested tailoring approaches compared to tailoring implementation strategies compared to sort of standard implementation strategies was effective, but they did conclude that it's not clear how best to tailor implementation strategies, and thus not necessarily clear what the effect of an optimally tailored implementation strategy would be. And excited that Sheena McHugh and colleagues are updating this work through a Cochrane review that's underway. So hopefully the literature has advanced. I know that we've identified many more studies that will be included in this review. Hopefully the clarity and transparency of the methods used to tailor implementation strategies has improved over time. But we'll see what we learn from this review, and excited to keep you all posted on that as it evolves. In the course of laying the groundwork for that review, Sheena led a sort of a conceptual paper on some of the conceptual and methodological issues that were coming up as they looked at that literature. And this is work related to Dr. Clack as well. I know was engaged in at least one of these papers, and so would love your thoughts as well when the time comes. But there are many issues related to even the definition of tailoring. So some people are suggesting just the systematic development of implementation strategies to address prospectively identified barriers is a tailored implementation strategy. Others would suggest it means using different implementation strategies for different sites, or even using different implementation strategies across the course of implementation as needs emerge. So there's a lot of differences in terms of definition, the stages at which this occurs, the appropriate level for tailoring. So, for instance, should tailoring happen at the individual, team, organizational, or system levels? And then again, the transparency of the methods that are actually used to carry out this work is a bit all over the place. And so I think our work is cut out for us. And I guess my message for this group would be we need you to develop and test out these methods. And so if you're interested, we'd be glad to carry that conversation as well. So I think there's a lot of exciting work in the field that not only is acknowledging that contexts differ, implementers differ quite a bit. They need different levels of implementation support. So for instance, sometimes people might need a very light touch implementation strategy in order to implement something effectively. Other times they might need quite a bit more support. And there's, of course, acknowledgement that our implementation contexts are constantly changing based on, geopolitical events, policies, a number of other factors that mean that implementation contexts are always changing. And thus our implementation strategies may need to be adapted over time. And so we've written a bit about on-the-go adaptation, as the paper led by Elvin Gang, where we consider how we need to consider the effects of adaptive implementation strategies over time. And Amy Kilborn and Danny Amaral and colleagues have really been leading the way on thinking about different types of adaptive implementation strategies and adaptive designs in implementation science. And so some of these adaptive implementation strategies mean that we might actually, be able to administer a light touch implementation strategy. And then if people respond to that, they continue to receive that. But if they don't respond based on a tailoring variable that we might measure, we might actually try a different implementation strategy, one that might be more intense or better suited to their needs in some way. So it's exciting to see these types of developments of more adaptive approaches that can be rolled out over time. So again, increasing focus in the field on how and why implementation strategies work, and sort of moving away from just these simple questions about whether or not they work, really trying to focus on the mechanisms of change here, or as Lewis and colleagues have defined this as the processes or events through which implementation strategies operate to affect the desired implementation outcomes. And there's a lot of attention in this, I think, internationally, certainly in the US, the National Institutes of Health and specifically certain institutes have really prioritized this work. And so it's great to see some interest and enthusiasm around this. Admittedly, not everyone is so enthusiastic about mechanisms, and so we'll see how our conversation goes today. These examples are perhaps way too simple, but want to demonstrate the type of alignment that we would like to see between the types of determinants we're identifying, the strategies we're using, the mechanisms, and the outcomes. And so just to give a couple of examples on this page, if we have a provider skill deficit, it may be that teaching or training with teaching and practice with corrective feedback is an appropriate implementation strategy that might operate through the mechanisms of skill acquisition, refinement, and mastery, and that would be reasonably linked to something like fidelity to an evidence-based practice. In another case, turnover is a huge problem in a lot of fields. So a train-the-trainer approach that ensured real-time training and consultation is available at the local site might lead to an implementation outcome like sustainment. And we've been doing a lot of work to think about how and why implementation strategies work. And one of the things that we've found is that it's not always possible for a single strategy, at least, to achieve something like fidelity or sustainment. Sometimes they get us only to assessing acceptability and feasibility, for instance. And so we found it quite helpful to be able to map these implementation strategies onto the types of mechanisms and outcomes that they're operating through. Ultimately, as we think about prioritizing the evaluation and conceptualization of mechanisms in the field, we think this will help us to improve our design and tailoring of implementation strategies, certainly in ways that I've already suggested. We ultimately hope that it will enhance our ability to learn from negative studies. So if a strategy doesn't work, rather than just throwing it out and trying something different, hopefully this enables us to ask better questions about why didn't it work? How can we actually tweak this or adapt this over time? Similarly, if we have positive findings, how can we actually replicate that in different settings? We also think identifying mechanisms will be really critical in facilitating the successful adaptation of an implementation strategy from one setting to another. If we know how and why it works, we'll know what types of factors might need to be changed as we apply this work in other settings, which ultimately will help us to generate a better understanding of generalizability and the role of context in implementation. I know I'm not doing great on time, so I have several examples of different ways of thinking about mechanisms for your implementation strategies. And one of the things that I hope to illustrate is that you might sort of identify strengths and weaknesses of these approaches. In my view, they're all different ways of conceptualizing how and why an implementation strategy works, and really opportunities to make our thinking explicit about that. So rather than just having implicit theories about how implementation strategies work, actually visually depicting and putting down on paper how we think these strategies are working to achieve our intended outcomes is important. So Kara Lewis, Brian Weiner, Pedro Klasna, and others have led this development of causal pathway diagramming. I neglected Rosemary Meza, who's also been outstanding in leading this work. This is just one example here that I won't read, but this approach really is encouraging us to not only specify an implementation strategy, but think about what barriers is it addressing or determinants is it addressing, what are the mechanisms through which it works, and then as we think about proximal, intermediate, and distal outcomes, can we outline those to really think about what are some of the earlier signs that we would see that the strategy is actually working or not, to hopefully, again, allow us to optimize implementation strategies over time. It's also forced us to think about moderators and preconditions that might influence whether or not an implementation strategy is effective, and also think about how different operationalizations of an implementation strategy would actually influence whether or not it activates certain mechanisms and whether or not it achieves certain outcomes. There's an excellent toolkit for this on causal pathway diagrams. If you want to kind of walk through this process, this gives you some prompts and some great material to walk through. So would point you to that at the hyperlink below. if you want to read more about this. There's also a great paper that was just published in Implementation Research and Practice by Pedja and colleagues. And this table is just the key functions of causal pathway diagrams, many of which overlap with some of the points I've already made. So won't read these today, but you'll have these slides if you want to take a look at this. And as I mentioned, we're engaging in ongoing work. This is a National Cancer Institute funded R01 to Kara Lewis and Brian Weiner, where we're building a database of strategy mechanism linkages and associated causal pathway diagrams. So essentially, we're developing causal pathway diagrams for 30 commonly used implementation strategies. We're developing psychometrically strong and pragmatic measures of different mechanisms. And ultimately, we are disseminating this via a website of implementation mechanisms knowledge. So stay tuned for the products of that as the website is launched in the coming years. I think for the sake of time, I'm not going to go into the details of this, but again, there are different ways of depicting mechanisms in implementation science. This is a paper led by Elvin Gang. There's another reference below here by Amy Kilborn and colleagues. This really is a variation of a directed acyclic graph approach. So if there are any epidemiologists in the room, you might be used to thinking about documenting causal processes these ways. But so this is a variation of that. I think, again, also quite helpful in making our thinking explicit about how and why implementation strategies work, and the types of moderators or contextual factors that are actually influencing whether or not they're effective. So we'll point you to that if you want to read further about that. Again, just different examples of how to depict this in a grant. These are also, I should point out, not mutually exclusive. So this is work by my colleague Lydia Kwok at Karolinska, who designed an implementation strategy and specified these mediators through which she thinks the implementation strategies or the components of the implementation strategies are working to achieve their ultimate outcome of interest, which is fidelity. So this is a bit of a broader look. She's also played with causal pathway diagrams and other ways of depicting this. So I think the point here that I'm trying to drive home is do think about how and why strategies work and think about explicitly putting that on paper. Again, increasingly, we've been trying to think about different system science methods, whether it's agent-based modeling, network analysis, system dynamics, and group model building, and the like, to think about how we can understand complex mechanisms in implementation science. Sometimes our approaches to developing causal pathway diagrams or other approaches are criticized as being overly linear. This is one way of integrating complex feedback loops and other dynamic aspects such as time to our depiction of implementation mechanisms. And just to point out, we have a special collection in implementation science and implementation science communications that is highlighting work led by Kara Lewis through an AHRQ funded effort to develop a research agenda for understanding mechanisms in implementation science. And we have a few papers already in that special collection. And the main findings from our research agenda development work through a 3-year conference series is under revision right now at the journal. So hopefully that will be published soon, and keep your eyes out for that in implementation science communications, knock on wood. So thinking about the mechanisms through which implementation strategies work is also, I think, a natural segue to thinking about potential unintended consequences or ripple effects of implementation strategies, be they positive or negative. So it's often assumed that our implementation strategies will have positive effects, that everyone will love implementers and no bad things will happen. But we obviously know that implementation efforts can lead to things like emotional labor, data gaming, where people might be actually faking numbers to suggest that they're doing better with implementation than they really are. Similarly, treatment counterfeiting, so maybe saying you're delivering a certain treatment when you're really not. It's sort of name only. Potentially a lot of administrative burden and other opportunity costs as you're not implementing other practices. There are also a number of positive consequences. So just to name a few, things like job retention, things like using evidence-based implementation strategies intervention strategies for self-care or with friends and family. So there can be a lot of positive unintended consequences as well. Mike Pullman and colleagues have done some really interesting work in children's mental health to identify some of these ripple effects. But I think this is something that we should do a better job of anticipating, and I think thinking causally and trying to map the mechanisms through which our implementation strategies work is one way of hopefully getting us to a place where we can better anticipate some of these unintended consequences, which I know sounds like a bit of a contradiction. This is a beautiful paper on audit and feedback by Catlow and colleagues that actually shows this very thing. This is a dark logic model, if you will, of audit and feedback, and shows how through this qualitative work, they identified things like gaming, things like lowered self-efficacy amongst physicians who are delivering colonoscopies, and other negative unintended consequences of the use of this implementation strategy. So I think we would do well to start considering that, monitoring, evaluating, and reporting those types of consequences in our work. Thank you for hanging with me. I think I have like 3 or 4 more slides, so we're in the home stretch. I mentioned at the outset of this presentation that reporting in the field is a huge problem, and that's both in terms of consistency of terms used, but also just the level of detail by which we report our implementation strategies in the literature and other interventions. Obviously, poor tracking, specification, and reporting limits our ability to replicate effective implementation strategies and interventions in science and practice, and it really precludes answers to how and why strategies work, or that whole mechanisms piece that we were just covering on the previous slides. And so this is work led by Nuala Proctor and Curtis McMillan and I, where we suggested that people name implementation strategies, hopefully in using terms that are consistent with the literature. So some of the taxonomies of implementation strategies and behavior change techniques and methods are one way of doing that, sort of standardizing that language. But then also that people clearly define each implementation strategy operationally, that they then specify each strategy according to the actors involved, the specific actions that were taken, the action target, which gets a little bit into the mechanism and how the implementation strategy works, the timing and dose of the implementation strategy, and then the implementation outcome, or as I emphasized through the causal pathway diagramming approach, this could be other intermediate or more proximal or distal outcomes that might be influenced by these implementation strategies. And then finally, is there some sort of empirical, theoretical, or pragmatic justification for why you're using these implementation strategies? And each of these components, even if you have a multifaceted strategy that has multiple single component or discrete strategies, it would be great to see people actually specify those strategies according to these criteria or something similar to that, to help improve the clarity of the literature and hopefully help us to understand how people got from point A to point B in implementation studies. Along those lines, there's been an increasing amount of work focusing on implementation, I should say, fidelity to implementation strategies. Chris Akiba has led a lot of that work. He was a doctoral student at the University of North Carolina and is now at RTI, and would urge you to take a look at those papers. We also have a lot of work to think about different ways of tracking and monitoring implementation strategies over time. So some of you may have seen the FRAME IS or FRAME implementation strategies framework that helps to document the types of modifications that are made to implementation strategies. This graphic on your right is from a paper by Amber Haley, where she suggested that we really need to document and describe plan strategies, but then again, to the notion that strategies may change throughout the course of an implementation effort, we need to track that strategy use over time as we monitor barriers and solutions, and as we potentially modify implementation strategies, add strategies, or even drop implementation strategies. We need to document that carefully using the same standards as I showed on the previous slide. Admittedly, this is burdensome, and so I think a lot of people are continually thinking about how do we do this in a more efficient way? How do we do this in a way that's quite informative to implementers? And what do we do with the data on the back end? So once we've tracked this in great detail, how do we use that to make sense of our implementation findings through process evaluations and other implementation evaluations? Just wanted to put a plug in for Luke's paper on designing and undertaking randomized implementation trials. I did not emphasize a lot on implementation trials and different designs. This paper does a nice job of giving you at least an overview of some of the types of trial designs that can be used to test implementation strategies, but also a lot of just fundamental aspects of reporting within implementation studies that I think are quite useful. So please do take a look at that if you have a chance. And again, sorry for going over, but thank you so much for your time today, and looking forward to our discussion over the next 30 minutes or so.
Thank you very much, Byron, Dr. Powell, for the excellent presentation. It was really appropriately titled "The State of the Science of Implementation Strategy," and I really appreciated that you gave a really rich overview of some of the work that you and others are doing in this field, as well as a really, really rich set of slides, a lot of material for those of us that are interested in going back and digging deeper into some of the topics that you've presented. So thank you very much for that. Really appreciate it.
Thank you.
So as the questions come in the chat, I wanted already to kick us off. You mentioned at the very beginning this kind of Tower of Babel challenge that we have when we talk about implementation strategies and using different terms to describe what is essentially the same thing. And some of the efforts that you've been leading and others have been leading as well around creating taxonomies and giving a name that can then always we use the same name to refer to the same thing. What is your sense in terms of, have we gotten better? I mean, Eric has been around, for about 10 years now. The behavior change taxonomies also have been around for about a decade. Are we getting better? Now we have established terminology that would provide us tools to use these things. And do you get the sense that we're moving in the right direction?
Yeah, that's a great question. So I think overall I'm optimistic, and I think that the tools that have been developed have like pushed us in the right direction. That said, I think that all of the tools that exist require a lot of sometimes expertise and interpretation, and as I mentioned, plenty of room for critique, at least in terms of how Eric has been applied. And sometimes when people are applying this to code implementation strategies or track implementation strategies, for instance, there's a lot of sort of consensus building that needs to be done and interpretive work. So I'm not sort of convinced that any of our compilations or taxonomies is perfect on that front. And in fact, I tend to think that efforts to improve reporting and the detail of what people actually did might do more than the actual names that people use to describe the interventions. So if we can get into the details of what was done, then I think people can sort of crosswalk that with other language that they might use. So I guess I tend to have even more optimism that those types of strategy reporting guidelines would do us some good if we would adopt those regularly.
I imagine you might also grapple with that yourself when you're describing implementation strategies used in your own effort. that it's difficult sometimes to stick within the frames of existing compilations or taxonomies. And I would agree. I think the reporting specification recommendations can be an excellent way to wiggle around that space.
And if I didn't suggest this, I want to be very clear. I don't think, because sometimes people get the idea like, oh, so I have to stay within this taxonomy or that taxonomy. And I think there's plenty of room for creativity and innovation, and people shouldn't feel constrained by this. My colleague Kate Livero says, "Tools, not rules," and I think that's a good moniker to live by.
Excellent. All right, so I'm just looking as some questions come in the chat. I see we have Michelle Wenzing has a question. Michelle, would you like to speak, or shall I read the question for you? Hi, good to see you.
Yeah, I noticed that this work, so thank you very much for your lecture, very comprehensive. I noticed that particularly this work on linking Siva and Eric has become almost a recommendation of in some funding programs, at least in the Netherlands. So people are encouraged or obliged to use it. But if I understand it well, it's based on expert views. And of course, these are all very wise and experienced people. Or what another way to phrase my question is, how do you assess the state of knowledge in this field? Is this the best we know now, or but we have to be careful, or is it sound? What is recommended? So what's your view on that?
Yeah, so it's a great question. Thank you. And I want to respect the work and not sound too negative about it. But again, I think when we originally looked at that, we were sort of like, shoot, was this a failed experiment? Because we would have sort of, basically what we asked people to do was, for any CFR construct, we said, what are up to 7 strategies that might address this? And don't quote me on the numbers right now, but I think it was like, we would find like 40 to 50 strategies for a given construct. So we did find some consensus, again, with over 50% at least normalized to endorse a given strategy for a construct. And so we had some confidence in those recommendations, at least in a sort of face validity sense, but it's not at all based on evidence. And it actually freaks me out a little bit if it's recommended in a prescriptive way. I think it can be a useful first step. When we were doing that project, Maria Fernandez came on, and one of the things that we started focusing on is sort of like both Eric and CFR are these sort of blunt categories of both strategies and constructs. And I think using something like intervention mapping or implementation mapping, and thinking again about more carefully about how and why these strategies might be linked to these types of constructs and other outcomes of interest is, I think, the necessary work. So when I recommend it, or if I ever do recommend it, it's sort of as a first step, maybe get us started, but that we really want to sort of follow up with that more robust thinking about the mechanisms behind these strategies, which I think also involves thinking about what do we have evidence for, and what is the actual evidence for these implementation strategies.
Yeah, thank you very much. I would have other questions, but first others.
Thank you.
Thank you. And I see that Maria Fernandez, good to see you, Maria, as well, is also active in the chat and has mentioned, that the primary study leading to the CFR-ERIC matching recommendation showed that there was actually a lack of consensus in many cases. And so I think that the recommendations, Byron, that you gave make a lot of sense in that context. All right, I'm just looking at the questions as they come in the chat, and it looks like Guillaume Fontaine has asked a question about determinant strategy matching. Guillaume says it would be interesting to compare results of expert consensus versus evidence-based links for example, what has been done in Susan Mickey's work, versus what generative AI suggests. Would you like to comment on that, Byron?
Just Guillaume, great comment, and looking forward to you doing that study. That would be super interesting.
Mm-hmm.
And I mean, it's perhaps far afield from the question, but Nat Taylor and others in Australia have done interesting work involving sort of like intuitive selection of implementation strategies compared to a more theory-based approach. So I think these different ways of thinking about this are really interesting.
And Byron, did I catch that correctly? Did you say that Sherry Regal is also working on something using machine learning in order to guide the ongoing adaptation of implementation strategies?
So I hope I don't butcher this, and so if anyone from Sherry's team is on, feel free to correct us. But without the aims in front of me, one of the things that we're doing is refining that both CFR and ERIC surveys. So again, for them, they find a lot of confusion when they give that to clinicians sometimes, and so they're trying to improve the quality of the survey so they get better data. And ultimately, the idea is that not that they're sort of adding to the current CFR ERIC matching tool, but that they would basically develop an alternative that would be data driven rather than expert consensus driven, so that they could see, based on their national evaluations and others that could input data using those surveys, could we over time develop a more evidence-based approach to matching strategies to barriers. So I think a cool project, ambitious, obviously, but hopefully we find some interesting things through that process.
Very cool. And I also, in regard to the work that you mentioned of Nat Taylor in Australia, our team as well, sometimes you invest so much in a very, a very thorough context analysis, a very rigorous process to come up with a tailored strategy. And at the end, you think, well, if we had just sat down with a piece of paper and did a brainstorming, might we have come up with something similar?
Right.
Do you have any suggestions to reassure us that the long hard road is a better one?
I don't know if I have assurances on that front. I actually think, not just saying this because Dr. Vensing's in the audience, but going back to the tailored interventions for chronic disease project and work that they led to actually compare different methods for identifying determinants. I think these are the types of studies that would be really interesting and helpful. And so great to see Nat and others take on and yourself, others take on those types of studies that hopefully will shed light on that.
I have one more question here in the chat from Nathan Steffens. What about the structural barriers to using the science in practice? Short-termism, funding, markets, norms? Maybe.
Yeah, basically.
Yeah.
So I work in the adult social care sector in the UK, which is systemically underfunded, broken essentially. And I work for a project that's trying to embed evidence in practice, trying to scale it up, take what works and try and implement that at scale. But we're doing this at a national level, but no one knows about implementation science. No one's using any of these theories, any of these practices. And it sounds like it's very academic, and in the reality of it, this doesn't really happen. And I just think there's a big divide. And if you use this in industry, and how have you overcome some of those challenges to getting people to buy into these theories and these strategies and dedicate resources, so core funding, to someone to do implementation work alongside the actual practice of adult social care or healthcare?
Yeah, so I won't be able to solve your problem, Nathan, completely, but I have a couple of thoughts and would welcome others. One, I think, just to respond to your sort of the comment that this is all very academic. I mean, that's certainly been acknowledged in our field, right? That perhaps we're sort of recreating the problem that we're trying to solve by being maybe too obtuse and having a lot of jargon, and that there's a challenge there. I also want to acknowledge on the positive end there that there's really a whole spectrum of people, some that are focused very much on advancing the methods of implementation science, but also applied implementers and people that are supporting applied implementers to do this work better. And so the notion of sort of more practical, pragmatic implementation science is out there, and I think we have an increasing number of training programs, literature, and things like that are targeted towards that audience, which I think can help. I also want to suggest my postdoc was in Philadelphia at the University of Pennsylvania, but it was funded through the Department of Behavioral Health there in Philadelphia. And so basically it had a bit of a front row seat to policy level efforts to implement evidence-based practices. And I saw, at least in that setting, with certainly strong academic partnerships, but I saw governmental level folks that were very much bought into this and eager to integrate implementation science and implementation based approaches into their work. So even things like changing requests for proposals to require certain elements to be defended from sort of an implementation perspective. Hopefully not in line with maybe what Dr. Bensing said about the C for ERIC matching tool, but ways to get people to specify their implementation process in a way that was clear, that I think nudged people towards thinking about these things more. Of course, the challenge that you mentioned with short time limits and things of that nature, I think are huge, and perhaps we don't do enough to invest in that level. I will shut up after one other thing that I thought of, which is I didn't focus much on this at all, but the idea that there are also people that are focusing on policy and implementation very squarely, and obviously a long history of policy implementation research in the broader literature, but also at least in the U.S., folks like Jonathan Pirtle, Erica Crable, Rebecca Lennox-Hall are close colleagues that are all trying to think about how do we work with folks at the policy level to really invest in this and do this well. So I think a lot of reason for optimism despite the challenges.
Thanks for that, Byron. Really appreciate that.
Thank you.
Right, so we still have a couple of minutes left in case anybody has burning questions for Byron. In the meantime, I see that Maria Fernandez has also highlighted in the chat that there is the Global Implementation Science Conference happening next week, and virtual participation is possible as well. So positioning this for our global audience, Byron, you have succeeded in bringing in a very international audience. We are not only among Swiss implementation researchers, so thank you.
That's great, and maybe great that Maria that you brought that up, and so definitely go to that. And I saw also the Nigeria Implementation Science Alliance is offering a similar conference down the line that folks may be interested in. So great to see those GIS conferences popping up.
Wonderful. Cool. All right. Well, if there are no more burning questions coming in the chat, I would like to take the opportunity to thank you again, really, for a very rich and thought-provoking presentation. I took several screenshots to share with people in the team to follow up on, so I appreciate that.
Thank you so much for the opportunity. Great to be with you all, and thanks for attending.
Thank you. And so before everybody jumps off, I have to highlight as well our own Swiss Implementation Science Conference, which is happening in November of this year. It will happen in Geneva. Oh, I'm ahead. First, I have to highlight the upcoming webinars in our series. So we have really the great pleasure to invite Dr. Bo Kim, who will present about systems analysis methods. So a really nice follow-up to some of the things that we've started talking about today. And then our fourth and final webinar of the year will be a roundtable with editors of the implementation science journals. So join us, please, with Drs. Gregory Ahrens, Paul Wilson, Bianca Albers, and Salas, and this will be a really interesting exchange to talk about this is the status of implementation science and how editors of some of the leading implementation science journals see some of the trends that we've also started discussing today. All right, and the final note that I have to give you, if you could switch to the next slide, please. Exactly, this is it. The third National Swiss Implementation Science Network Conference will be happening in Geneva this year. It will be on November 7th and 8th, and we have officially launched the program, the conference website, and so we are now accepting abstracts, and we look forward very much to receiving your abstracts and to meet you in Geneva for a wonderful and enriching conference. All right. So with that, I thank you again, Byron. Thank all of you for being here and for the interesting discussions, and wish you all the best.